Thiazide diuretics are a class of drugs that work in the distal convoluted tubule of the nephron in the kidneys. They inhibit the sodium chloride symporter, which decreases the reabsorption of sodium and chloride. This leads to increased excretion of sodium and water, reducing blood volume and lowering blood pressure. One common example of a thiazide diuretic is hydrochlorothiazide. These diuretics are often prescribed for managing hypertension and mild to moderate edema. By reducing blood volume, they help alleviate the pressure on blood vessel walls, making them effective in lowering blood pressure. Loop diuretics act on the thick ascending limb of the loop of Henle in the nephron. They inhibit the sodium-potassium chloride cotransporter, also known as NKCC2, which leads to decreased reabsorption of sodium, potassium, and chloride. This results in a significant increase in the excretion of water, sodium, chloride, and other electrolytes. Furosemide is a well-known loop diuretic. These diuretics are particularly potent and are used in conditions requiring rapid and extensive fluid removal, such as acute pulmonary edema and chronic heart failure. Their powerful action makes them essential in critical care settings. Potassium-sparing diuretics act on the distal convoluted tubule and collecting duct. They inhibit the action of aldosterone, known as aldosterone antagonists, or directly block sodium channels, known as epithelial sodium channel inhibitors. This results in increased excretion of sodium and water while retaining potassium. Examples include spironolactone, an aldosterone antagonist, and amiloride, an epithelial sodium channel inhibitor. These diuretics are often used in combination with other diuretics to prevent potassium loss, which can be a side effect of other diuretic classes. They are particularly useful in conditions like heart failure and hypertension. Carbonic anhydrase inhibitors work in the proximal convoluted tubule. They inhibit the enzyme carbonic anhydrase, which decreases the reabsorption of bicarbonate, sodium, and water. This leads to increased excretion of bicarbonate, sodium, and water, resulting in a mild diuretic effect. Acetazolamide is a common carbonic anhydrase inhibitor. These diuretics are often used to treat conditions like glaucoma, altitude sickness, and certain types of metabolic alkalosis. Their unique mechanism makes them suitable for specific medical conditions, where altering bicarbonate levels is beneficial. Osmotic diuretics act primarily in the proximal convoluted tubule and the descending limb of the loop of Henle. They increase the osmolarity of the filtrate in the nephron, drawing water into the urine through osmosis. This results in increased excretion of water and a variety of electrolytes. Mannitol is a well-known osmotic diuretic. These diuretics are used in situations requiring rapid reduction of intracranial or intraocular pressure, such as in cases of brain edema or acute glaucoma. Their ability to draw water out of tissues makes them invaluable in emergency medical settings. Diuretics reduce blood volume by decreasing the reabsorption of sodium and water, which lowers blood pressure. They also influence electrolyte balance, affecting their clinical use and side effect profiles. Often, diuretics are combined with other antihypertensive drugs to achieve better blood pressure control and manage conditions related to fluid retention.